I'm Bobby Fisher, and this is my Aesthetically Awkward podcast, a show where we dive into all things aesthetics, health, wellness, entrepreneurship, and everything in between. This podcast is for informational and entertainment purposes only. It is not medical advice. Please consult your own healthcare provider before making any decisions in your personal health journey. Now let's get into it. Welcome back to the podcast. Thanks for tuning in to another week. After my last episode, Progesterone Made Easy, I had an outpouring of questions on my Instagram stories. That told me two things. First, women are listening, they're paying attention, which I love. Second, keeping the episodes bite-sized means that I don't always have the time to cover everything that matters. That part falls back on me. So this is actually going to be a continuation of Progesterone Made Easy, a deeper conversation that builds upon what we already covered. Progesterone's not a simple hormone. Trying to explain it in 10 minutes means that some important pieces are going to get skimmed over. Today, we're going to talk through real listener questions, walk through how those situations might be handled in real everyday practice, and cover a few areas that we didn't fully explore last time, like luteal phase defect, why progesterone is prescribed along estradiol, and how progesterone might affect your mood and your sleep at the brain level. We are going to be pausing the hormone series for a little while as we shift into some aesthetics content, team conversations, interviewing some of the staff that work here at LuxLift. But if you have more questions, head over to Instagram. Participate in those question boxes and polls in our stories. Comment on the episodes. Comment on our reels. We'll continue the conversation in future episodes. Before we dive in, we're going to go behind the mic where I share a flex or a flop. My flex is the engagement after the progesterone episode. Women didn't just listen, they reflected, they questioned, and they reached out. That tells me that education is needed and the topics that I'm touching on are something that you want to hear. My flop is that I didn't get the chance to cover everything about progesterone, and that's going to be difficult to even do in this second episode. My intention is to keep these episodes bite-sized, but that does mean that women were left with questions that deserved a deeper explanation. This episode is my way of correcting that while still respecting your attention span. Let's go ahead and hop into the progesterone. One of the questions I received in my Instagram stories was, I've tried hormone therapy, but I had spotting, even though I hadn't had a period in almost 3 years. So my doctor took me off of my hormones. Bleeding after menopause always needs evaluation. That is non-negotiable and it's supported by evidence. Where things can fall apart is what happens next. Progesterone is prescribed to protect the uterine lining. And the reason is because estrogen can cause something that's called endometrial hyperplasia. Progesterone stabilizes that uterine lining and it prevents it from growing in excess or thickening. Progesterone's not optional when systemic estrogen is used in women with a uterus. So when you first initiate hormone therapy, some women experience spotting as the lining adjusts. That doesn't automatically mean hormone therapy should be stopped permanently. It means that you need to rethink the dose, the timing, the route of progesterone. There is further evaluation and assessment that needs to be done. You shouldn't just be taken off of the hormones indefinitely. Depending on the situation and the circumstances, the provider might need to order a pelvic ultrasound to assess the endometrial thickness. If the bleeding were to persist or the lining appeared thickened, then you're looking at an endometrial biopsy. The goal is safety, not reflexively discontinuing the therapy without any explanation or offering an alternative solution. Hormone therapy is not all or nothing. Adjustments are part of appropriate care. Another question from a listener was, my periods are sporadic every 2 to 3 months. My nurse practitioner checked my follicle stimulating hormone, said I was in menopause, and they stopped the hormones I was on. They sent me for an ultrasound that was normal, but they won't restart my hormones until after I have a biopsy. So I didn't get all the clinical information, but I've seen cases like this, and it kind of bridges on the question that we just had. Irregular periods every few months indicate perimenopause, not necessarily menopause. Menopause is defined as 12 consecutive months without a period. So that FSH, or that follicle stimulating hormone, it fluctuates significantly during perimenopause. One single stimulating hormone value doesn't necessarily confirm menopause, and it should never be used alone to make that treatment decision. A normal pelvic ultrasound is reassuring. It doesn't automatically eliminate the need for further evaluation if you're having abnormal bleeding, but at the same time, a biopsy should be explained and it shouldn't be used as a barrier to care. You have the right to make an informed decision. Hormones should not be stopped solely based on that follicle stimulating hormone, especially if the bleeding pattern is telling a different story. Being able to see the full clinical picture, discuss those symptoms with you, look at those lab results, look at the diagnostics. All that information should help your provider make an informed decision. If you feel like your provider is not listening, you have the right to a second opinion. Multiple women ask about luteal phase defect. Several listeners said that they had that diagnosis or wanted more information. Luteal phase is the second half of the menstrual cycle after ovulation. During that phase, that's where the ovary is producing progesterone. In a luteal phase defect, progesterone levels are either too low or they don't remain elevated long enough. Symptoms include having a short cycle, spotting before your period, infertility, recurrent pregnancy loss, significant PMS, anxiety, sleep disruption. This is actually something that I'm personally affected by. Lab evaluations for a luteal phase defect. We like to check a mid-luteal progesterone level. We ask you to track your cycles. We need to assess your ovulation patterns. Timing your labs is really critical here. A progesterone level drawn at the wrong point in your cycle could be misleading. Untreated luteal phase defects could include infertility challenges and potentially decrease your quality of life. Management's going to depend on the goals. This is something that can be treated, but the treatment needs to be individualized based on your needs. I had a handful of women who asked questions about feeling flat or depressed or just feeling off while taking progesterone. And that's where we need to talk a little bit more about progesterone and its effects on the brain. Progesterone is metabolized into compounds that interact with the GABA system in the brain. GABA is the primary inhibitory neurotransmitter. It plays a role in calming the nervous system. It promotes sleep and it reduces anxiety. So for many women, that interaction improves sleep and creates a calming effect. For others, especially depending on the dose, the formulation, your individual sensitivity, that interaction can actually lead to a low mood, emotional blunting, or that flat affect, even depressive symptoms. That doesn't mean that progesterone is unsafe or inappropriate. It just means that the brain is responding in a way that requires adjustment. Options could include changing the dose, altering the timing of the dose, switching the route of administration entirely, going from oral to a topical, instead of doing a continuous progesterone replacement therapy or timing it with your cycles. As always, it is critical to make sure that you're addressing your sleep, stress, and your nervous system regulation alongside your hormone replacement therapy. Mood changes should never be dismissed as that's just how hormones are, that's how they work. These are physiological responses and they deserve explanation, and your treatment plan can always be modified. But it also helps explain why progesterone can help hot flashes and sleep for some women while causing those mood changes in others. The same mechanism can feel very different depending on the person. Another listener said, I want to see you for pellets, but you told me you don't do estrogen pellets. Has that changed? I do offer testosterone pellet therapy. I typically choose transdermal estrogen patches. They are bioidentical. More often than not are covered by insurance. If necessary, we'll also do a topical cream when appropriate. This allows for more precise dosing and adjustments as needed. Once a pellet's placed, it can't be adjusted or removed. You just have to address the side effects if they occur and wait for the levels to decline. I don't like that lack of control. That decision for me is based on safety, flexibility, and clinical management, not convenience. So for right now, estrogen is still not something that I offer via pellet therapy. Since this was a bonus episode that really focused on all the questions that I had in my inbox related to Progesterone Made Easy, I don't have a specific unfiltered Q&A this week. But remember, I am actively posting in my stories over on Instagram. So follow at Aesthetically Awkward Podcast and Bobby the NP _Luxlift and engage in those stories. The next few episodes are going to be me and my teammates here at Luxlift. I'm going to be interviewing them, discussing their background, their favorite treatments, skincare products, things of that nature. So if you want to learn more about any of the team members here at Luxlift, now's your chance to ask. I really hope this episode filled in the gaps left behind by the first conversation. If you're on hormone replacement therapy and it doesn't feel right, we can work with your lab values and your symptoms to help tailor a plan to improve your quality of life. You don't have to just struggle through it. Hormone care should be a collaboration between you and your provider. It should be individualized. You deserve to understand what's happening within your body. While we are going to be pausing the hormone discussion for a little while, it will continue in the future. If you want to help shape future episodes, find me on Instagram and be a part of the conversation there. Thanks for being here. I hope you have a great week, and I'll see you next time on the Aesthetically Awkward Podcast.